Dr. Demerjian's office over here, dental clinic over here, and I've been diagnosed with TMD by him, and I'm under treatment with him right now. And prior to that, 3 years back, I was a runner. I was a very active person. Then suddenly it started with a dizziness, and I was given into a lot of treatments. They said first it is a vertigo, and then I had started having chronic fatigue syndrome, and I didn't know what was happening inside my body. A lot of dizziness, and then the chronic fatigue slowly started, and by and by it started to deteriorate, and I was not even able to get up out of my bed. I was totally on bed, and I was not able to breathe properly. I didn't sleep properly, and I was so irritable, and I had a lot of brain fog. And when someone asked me a question, where is this address or what is that person's name, I was not able to remember immediately, and I had to think and think and think in about 5 or 10 minutes or a day to figure out what was the answer. And I was trying to think myself that something is wrong with me, but I was not able to know what was the proper thing going on with me. I had run a lot of blood tests, about 5 to 6 times, the same RBC and all those counts and everything, about 7 MRIs done, and then the contrast CT scans of my ear and everything, but all the things came out to be normal. And I had to go and meet a neurologist, and even my EEG reports came normal. And when I went and met the neurologist, she checked me out, and I told her I have a severe chronic fatigue, and I'm having a lot of dizziness, and I'm not able to remember things. And she checked me out, and she said, everything is in your head. And she said she didn't want me to meet her again, and she says it's all hallucination thoughts that I have. I told her, I complained her of a lot of spasms in my mouth, in my jaw, and in my hands and in my legs. But she said that it's a hallucination issue that I'm having, that I have to go and see a psychotherapist, that something has happened to me inside myself. So she told me I have to take a lot of medicines to go through all those things. And half of the time I was with a lot of drowsiness. I used to sleep all the time. I didn't have any life in my home. I just used to be a dead piece of meat, a dog with nothing in life. I used to get up late in the morning and I just had something, but what do I have? Nothing. It's the same chronic fatigue. I used to crawl and I used to get back to my bed. So after this I came here with Dr. Demerjian, and then I came to know that I had the TMD issue, and he started treatment with me with the appliance over here in the lower and in the upper jaw area. And this is my first this thing with him, appointment with him. So I'm confident and I'm happy that I'm in the safe hands with him, and I know I will get off all these issues. So I'm happy with this treatment right now and the way he's taking care of me.
Now tell me some of the symptoms you had in your face and head and neck.
Yeah, to be honest, I want to tell, I didn't have any pain. So when the other people where I was looking before, they asked me, I said, I didn't have pain, so you don't have any TMJ. So that was the cause, and no MRIs or anything was taken. I had a severe jaw spasm. I had trunk thrust. It used to pop up every day, out and in, and severe jaw spasms. And then I had tremors all over my body. It used to shiver and shake. I had even tremors in my eyes. It used to blink very fast. And then I had a spasm severe in my neck and in my hands and in my whole part of my body. I felt inside my body my muscles were not balanced. And whatever it used to happen, like suddenly I used to go haywire, like my hands would go to one side, my leg used to go side, my mouth used to go side. So I refrained from going out nor with family outside, and I used to stay at home always. And I was just thinking of what was going on inside my body. Though again I had to go to a neurologist, again I booked up an appointment to see her, and then she was angry with me and she said again the same quote that everything is hallucination, it's all your thought, there is nothing wrong with you, so you have to go to a psychotherapist. So with a lot of medicines, now I'm totally, after this appliance is put, now I'm totally off into those medicines. I'm not taking that medicine anymore. Though it takes time for me to have a good sleep, but now I'm feeling like the drastic medicines which I was taking before, now I am not taking any much more right now.
Okay, I just want you to take out the mouthpiece and let's see.
Okay.
Let's see the spasms that you were having. Okay, go ahead and put it back in.
And without spasms, maybe.